Hello, everyone. My name is Kyle Hayes, and we welcome you to Health Reform Beyond the Basics. Beyond the Basics is a project of the Center on Budget and Policy Priorities, and it's designed to provide training and resources to facilitate enrollment in the health insurance marketplace and Medicaid. We provide these resources for healthcare assisters, advocates, state and local officials, and others who help people get and keep their health coverage. The Center on Budget and Policy Priorities is a nonprofit policy organization and is not a part of the U.S. Department of Health and Human Services. And just a note as we get started here, this webinar series is not intended for press purposes. Next slide, please. Here on this slide, you can see our upcoming webinars. As a follow-up to today's presentation, we'll be hosting small group workshops on plan comparison tools in August. These workshops are capped at 30 attendees and are intended for assisters who will be creating tools for their organizations. Our August 16th workshop is full, but we still have space remaining in our sessions for August the 18th and August the 23rd. And these sessions all contain the same content, so there's no need to register for more than one. And below that, you'll also see the dates for our open enrollment series starting in September. Now, you don't have to write all these dates down. After the webinar, we'll be circulating these slides along with a video recording of today's presentation and additional resources. And we'll also post everything to our Beyond the Basics website. Next slide, please. A couple logistics before we begin. All participants are muted and in listen-only mode. If you'd like to ask a question, click on the Q&A icon in the control panel at the bottom of your webinar screen and type your question into the box. We'll be monitoring questions and we'll pause for Q&A at the end of today's presentation. We may not be able to answer every question asked, but we will have a record of all of your questions and we'll use them as a guide for future resources and presentations. And you can also email your questions during or after the webinar to our email inbox at beyondthebasics@cbpp.org. Next slide, please. Today's webinar will provide information about the landscape as we head towards open enrollment and information about building network overview and plan comparison resources. Today's presenters are Arianna Anaya. Arianna is currently an adjunct English instructor at Norwich University in Vermont, and she previously served as a certified application counselor, community health worker, and navigator in Texas and Illinois between 2014 and 2022. And also joining us today is Jenny Sullivan. She is the Director of Health Coverage Access here at CBPP. And with that, I'll turn it over to Jenny to get us started.
Great, thanks so much, Kyle. Next slide. Great, so before we get to today's main speaker and main topic, I wanted to provide some brief context about the marketplace landscape going into open enrollment this fall and why it may be more important than ever to prepare tools to help the people you assist compare their options. There are at least three major factors that will influence the upcoming open enrollment season. We have record marketplace enrollment for this year, plus uncertainty around whether the enhanced subsidies from the American Rescue Plan will continue, plus a possible fix to the family glitch taking effect. These factors together will make for a very busy year for enrollment assisters. And while it looks likely that the public health emergency will be extended, and so the Medicaid continuous coverage provision will remain in effect during open enrollment, that's another potentially complicating factor lingering on the horizon. So just to unpack these pieces a little bit, record enrollment. During the last open enrollment period, y'all knocked it out of the park with more than 14.5 million people selecting a plan or auto-enrolling in marketplace coverage. Enrollment was up by 20% in 20 states. More than 1 out of every 5 enrollees, though, is new to the marketplace this year. They've never been through the re-enrollment process and they may not know what to expect or the importance of returning to the marketplace to shop this fall. The enhanced subsidies that were available for this year made a big difference. Nearly a third of enrollees chose a plan with premiums that were $10 a month or less. Now let's unpack uncertainty around subsidy levels. So for the past 2 years, subsidies were larger and available to more people than in years past. The average monthly premium this year was $133, down from $164 last year. 1.1 million people with incomes over 400% of the poverty level receive subsidies who wouldn't have at all without the rescue plan's enhancements. Now, unless Congress takes action, these enhanced subsidies will not be available for the 2023 plan year. The Urban Institute has estimated that 3.1 million people could become uninsured if the subsidies are not extended. Premiums will increase significantly for many more people. Thirdly, a possible family glitch fix. The Treasury Department proposed a rule this spring that would fix the family glitch. It would be finalized before open enrollment begins. And if it's finalized as proposed, this means more people would be eligible for subsidies for marketplace coverage. It will be incredibly important to find these households, notify them of the changes, and help them explore their new options. So all of these factors together underscore just how important enrollment assistance will be this fall. We will have many people going through re-enrollment for the first time, the potential for confusion or mixed messages around subsidy size and availability, and as always, fluctuations in which issuers offer plans from one year to the next and plan design details. Next slide. Most of these things are out of our control, but there are things you can do right now, even though it's mid-July. First, research when issuers in your area are sending renewal notices and what they're planning to say about subsidies. Typically, these notices must include an estimate of premiums for the coming year. But CMS has told plans they do not need to include this information this year, given all of the uncertainty around the future of the enhanced subsidies. Number two, encourage people to return to the marketplace to update their information and compare their options. Now, we say this every year, of course, but it's especially important given that 1 in 5 current marketplace enrollees is new to the marketplace. And number three, why you're all here today, create tools to help people navigate the plan selection process. We're devoting the rest of today's webinar to this topic and hope that whether you've been making plan comparison tools for a decade or you've never created one before, you come away with some useful ideas and tips. And as my colleague Kyle mentioned, if you find yourself wanting to really roll up your sleeves and get some individualized help, we invite you to join one of our workshops next month. The content of each workshop is the same, but they're capped at 30 participants, so you can ask questions and get individualized technical help from Arianna. As Kyle mentioned, the workshop on the 16th is full, but we'll recirculate the links to register for the August 18th and August 23rd workshops when we send the recording and materials from today's webinar next week. With that, I'll pass it to Arianna.
Thank you so much, Jennifer. Let me make sure I have my ducks in a row. Yes, I hopefully do. So firstly, I am so grateful to be here. It's such a treat to have the opportunity to speak to sisters across the land. I wanted to start very briefly by sort of reiterating and reminding all of us of the prize of the assisting work that we all do. And, you know, there are a lot of different ways and a lot of different words that I think encapsulate what we are trying to do for our clients, for society generally, for United States healthcare. But I think the word that I'm going to utilize here is accessibility in the broadest possible sense, right? The intention behind the Affordable Care Act, the intention behind all the hard and amazing work that sisters do when it comes to client education and enrollment is all intended to increase access to healthcare and to not just coverage, of course, but to actual access to treatment and to being well in a physical and mental sense. So I do like to mention this because I think sometimes the more and more you explain something iteratively to clients, you know, we forget that every single day you are making an impact on this. And the intention with this webinar is to just provide some examples and some tips and tricks for how to continue with this very broad and very, very complicated goal of access. So to start with, when it comes to this notion of what accessibility is, obviously the first place that we saw access coming into play was the creation of the Patient Protection and Affordable Care Act, and how through subsidies, a kind of access was enabled to those who would otherwise not be able to afford health insurance. But secondarily, of course, access also has to do with how the law instituted certain protections when it came to pre-existing conditions, when it came to someone's rights to coverage and care, regardless of, say, their gender identity or their age or their medical conditions, their medical needs. So I think the rollout of the Affordable Care Act and the ways in which assisters all over this country helped clients understand their rights and responsibility was sort of that first step to creating a very literal access. And what I see as a goal that needs to continue and needs to kind of increase as we move into the law having existed longer, because it hasn't existed that long, has to do with this continuation when it comes to access. And it's kind of here that I would say we really want to start to build ourselves resources that are sustainable and that can assist individual assisters and clients with understanding and retaining that access. So that really is going to be the focus on how the resources that each of y'all build and that potentially we can assist with continuing to build and continuing to maintain can promote and continue this prize, this goal of access when it comes to health coverage and care. So what I wanted to talk about, hopefully briefly, I have a tendency to kind of go on and on, so I'm going to check myself before I even begin, is talking about resources in an analytical sense, to really focus to an extent on what they are doing, who they are for, and kind of what the purview of a resource is. And I'm going to use some examples from different partners in different states. So just a couple of considerations that I really want to make sure are in the back of our minds as we build resources is considering always what is sort of the intended audience for, or the intended answer almost of a resource. Are we trying to give a whole explanation, a background, the history, the context, or are we just trying to give clients and assisters the quote unquote answer? Secondly, thinking about how a resource will age, what kind of commitment you need to consider when it comes to maintaining the information. Is it possible to kind of build it once and ensure that the language on that first build will live, quote unquote, forever? This is very hard to do, of course, because there's so much that's changing or in flux when it comes to healthcare. Again, who is going to be responsible for that? How do we ensure that a resource continues to be accurate? How do we ensure as well that updating of this resource isn't going to be an onerous, challenging thing? And then finally, how will assisters either within your state or your organization receive and access that specific resource? What I really want to call attention to is a sort of resource building sweet spot when it comes to a resource that does quote unquote double duty. We're going to focus on sort of 3 areas to consider when it comes to resource building, talking about the audience of the resource, the function, what the resource is designed to do, and then the focus, what part of the process this resource addresses. And something I want to call attention to is that the best resources will do what I'm going to call double duty when it comes to audience and function, and I'll get into this a little bit more, but are singular when it comes to focus. And I'm going to give some examples of what that means. Okay, so this is kind of illustrative, but I've outlined focus as kind of having 3 major areas when it comes to building resources connected to enrollment. So first and foremost is this question of eligibility. Then we have the issue of navigating the application, which is very, very complicated and often needs its own sort of explanations and education for clients, but also for assisters. And then finally, the actual act of showing clients plans, to my mind, is a whole separate focus. So each of those areas often necessitate their own resources. And my general recommendation here is when you are building a resource, let the focus be singular. Don't try and do more than one of those spaces with one resource, because it will frankly be too much. Now, on the other hand, when it comes to audience, who that resource is for, and function, what it's doing and how it's doing it, I recommend highly looking for resources or looking to sort of build the tone and language of your resource so it does quote unquote double duty, so that your audience, it may be focused primarily on aiding the assister or the client, but ensuring that it has something for both parties will help everyone involved. The same goes for function. Obviously, some resources will be more instructive. We'll sort of give this step 1, do this, step 2, do that. But as much as you can also include some sort of level of information in terms of why these steps are necessary, this is really, again, going to be the sweet spot and is going to lend itself to the highest likelihood that this resource will be used and will be useful. So with audience and with function, you really want your resources to do this kind of double duty. Whereas again, for focus, my recommendation is to kind of stay in the lane of where that step, where that resource is happening in terms of the process. So our first example is going to focus again on audience, and this is a resource for Enroll Virginia. This is such a helpful, wonderful resource, intended, I would say, primarily for the assister. And what you can see here is essentially, it's an eligibility chart. It is giving a summation of what immigration statuses are eligible for what programs. Obviously, this may not be useful to individuals outside of Virginia because our state-based programming is so different, right? But as an example, I would say this is a beautiful example of something that is primarily built for the assister, right? Your average client who doesn't have a background in all these things won't necessarily get much from it. However, I would say the reason it's in that sweet spot is this can, in theory, be used by the assister to show the client and to reinforce what the assister is telling them when it comes to eligibility. So while this is not something necessarily built for the client, it is a tool that the assister can use when it comes to helping the client understand something. So this, again, wonderful, wonderful proof of something that kind of does that double duty when it comes to audience. So we have another resource. This is from the Health Navigator program at Legal Aid Services of Oklahoma. And this, I would say, is to an extent, primarily, I would say, purposed towards an audience of the client, right? You can see that there's an element of advertising in terms of what individuals can get from the specific program. But what I think makes this chart so brilliant and this resource so helpful is it is of a higher likelihood that the assister is going to pull this up and use it and give it to the client, because that little very detailed chart, the specificity of those numbers, right, is something that the assister will use, something that they will call upon when it comes to engaging a client or talking about the eligibility. What this then means is there's a higher likelihood that the assister will use this again and again for a multitude of clients. And in theory, the client then will gain access to this information that way. So this is genius, I think, in that it's touching both specific spaces. It has relevance for both potential users of the resource. Okay, moving on to function. And again, I've mentioned function in terms of either instructive or informational. And this is a resource from Center on Budget. I believe this was based on something my old entity built connected to dealing with identity verification. So of course, sometimes as you set up an application, you run into an issue with an individual's identity verifying. And this is kind of a workaround how to get the application to let us submit an application when this issue has arisen. I would call this a very sort of instructive facing resource. It is intended to walk someone through a process step by step. Here's how. But it does also have some informational elements that does sort of put it in that sweet spot, which is great. And again, it does also have an audience double duty in that while this is, I would say, intended pretty much 99% for the assister, an individual, a client who's a little bit tech savvy, in theory, could be given this resource and in theory could complete this on their own. Now, again, I would say that's not necessarily the intended audience or function of this, but it does have that kind of sweet spot double duty. It can work for more than one purpose, more than one audience as well. Okay, so I'm going to kind of call out myself here. This is a resource that I would say tends to be strictly informational. We all need these, we all use these. But I would say to an extent, this is an example of a kind of necessary evil when it comes to resources built for assisting, where on its own, this is strictly going to be informational. It doesn't really give us any context, right? It's just a FPL chart. So that former one I want to say is from Center on Budget. This is the one that my entity made after the passage of the American Rescue Plan. And so what the relevance is of this chart is not necessarily explained at all, unfortunately. So this is intended to be strictly for the assister, and that's okay. Occasionally you do need a resource of this nature that has the focus only on providing information with very little context. But what I would recommend is ensuring those resources are few and far between, and that those are going to be utilized by assisters to engage and explain bigger concepts to clients. And I wanted to provide an example of a resource, again, calling back to that Enroll Virginia resource that I mentioned earlier that does a good job of potentially working with both audiences. This is an example of a resource that is informational, and yet what you'll see is that this resource also on the latter pages offers explanations. So you have the chart, right? This sort of cheat sheet shorthand intended for the assister, but there is also additional information. There's additional context that moves this into a space where it's doing that sweet spot, that double duty. And again, keeping in mind, I'm using this as an example, and that the information would vary depending on your state. So I'm going to kind of call myself out because I built this resource, which is only informational and not instructive. And when I built this, I thought this was great. I thought everyone was going to use it, and nobody did. Basically, and you guys, when you guys have access, y'all, when you have access to this presentation, you'll notice that you can actually click on those different frequently asked question guides, and feel free to use that if you want it. But what I found is that this was not necessarily very useful for the assisters because it was too philosophical. It didn't necessarily provide instructions and answers per se. It more had these very general responses, and it was an endeavor to place talking points in front of our assisters. But because of how broad it was, I found that our assisters didn't really use this past the very first couple of weeks of open enrollment. They basically had learned the information by then, and there was no real reason to go back to the resource. So you can see the types of questions that I'm including here connected to pre-existing conditions. And I think this ultimately might be a good training tool, but ultimately it was not really a useful resource because it was kind of too informational. It didn't really have anything specific to a client's need. It offered general information that I think ultimately was not specific enough. It really didn't give clients anything that they couldn't themselves find if they went on the internet, for example. So this is going to be an example from Covering Wisconsin of a resource that manages to hit that sweet spot to my mind. So there are instructions, as you can see, in terms of how to find a specialist. You can see this steps 1 through 4. I believe there might be another step that I'm not using all of, but what I love about this is it gives us steps. It has kind of an end goal. It has a process laid out for the client, but it also has information in the right-hand column. So it, again, is hitting this double duty sweet spot where it gives directions. It gives kind of a how-to, but it also takes the client to an extent behind the scenes in terms of giving them a definition for what these things are as it takes them through the steps. So this, to my mind, is a really great resource that hits that sweet spot. And in theory, this functions well for the client, but also for the assister who's walking the client through this. A brand new assister can quickly remind themselves what a referral is, right? They're easily set up, they're teed up to answer the question if a client has it. So I think this is really a good example of a resource that's done double duty, both when it comes to that function and also when it comes to audience. Okay, So we're now going to talk about the focus piece. And this is where I recommend trying as much as possible to sort of stay in a specific area of the process and not trying to do double duty with a resource. I used this resource earlier to illustrate audience and function. And with focus, I'm going to call attention to the fact that this is fully focused on eligibility, kind of the first step when we sit down with a client. That's really good. What this resource does not try to do is tell clients of a certain immigration status what they're going to get per se, right? What it will look like when it comes to the plan selection, because that would be too much. And that would be frankly working out of order when it comes to what clients need to know as you tee them up to do the application. So this, I think, is a wonderful example of a resource that manages this double duty for audience and for function. But when it comes to the focus, they have picked a lane. They have let this resource be only about eligibility, and they're not trying to get into the second half of what that eligibility is going to mean in terms of plan selection, because it will be way too much to include on this one specific piece. Likewise, again, the resource I mentioned earlier from Center on Budget when it comes to identity verification, this resource also stays in its lane when it comes to focus. It's about the application. It doesn't try and step back too much into why it is a person's identity may or may not have been verified, what the impact could be on enrollment. It gives these instructions specific to getting through the application. It doesn't try and talk about what the issue might, what the immigration statuses are per se that might end up with this matter. It's focused on what needs to happen specific to this moment in an application. Finally, and I'm going to spend more time talking about enrollment resources because this is really the intended focus of this presentation and specifically of the workshops that will be upcoming. This is a great resource from Center on Budget, from Beyond the Basics, that I highly recommend assisters take a look at some point. It is linked below, and of course it's on the Beyond the Basics website. But this is a resource that is very functional when it comes to the double duty standard, and also when it comes to a focus on enrollment. And what I really want to call attention to when it comes to this resource is I think sometimes the sisters don't use it because there's so much. It feels maybe like a homework assignment. And I think the trick really is for sisters to understand you should just use what you need here, right? You don't necessarily have to fill out every single element of it. Clients might be only comparing two plans, right? Clients might not, for example, need the specific in-network physician filled out or hospital filled out. But this is a resource that has a very specific purview, and that purview is on plan selection and enrollment. So it stays in its lane. It gives definitions specific to that process. And again, this is something that is beautifully open-ended and can serve clients to the extent that the assister and the client need it to. There's no obligation to fill out every single piece of it. And I think familiarity with the form will best help assisters understand what parts of it they use most frequently, rather than feeling like they have a homework assignment. It can be printed. It can also be emailed as a PDF. It's a fillable PDF. So highly recommend clients use this. So I have kind of an overview connected to these recommendations, making sure as much as possible that anything you build can work for both. If it's just set up to target the assister or the audience, probably the assister will not use it very frequently if it's only for the client, if it has no information for the assister. Likewise with function, right? You want to give a detailed how-to, but some sort of optional instructive element is helpful, right? You want to make sure there's information connected to the instructions so people understand why they're doing what they're doing. So there's a reference point for the client and for the assister. But then with focus, pick your lane and make sure you stay in it, because you can wind up doing way too much with a resource if you are bouncing between those three major places in the process. Finally, big reminder, any resource that a client might wind up having make sure it contains some kind of disclaimer when it comes to the fact that all marketplace information is going to change, networks change, costs change, right? And I'll give an example of that in just a bit. Okay, so I now want to talk about specific network and plan resources, and that's going to be hopefully the bulk of what we discuss for the remainder of this presentation. The chart on the left-hand side is sort of an attempt to illustrate that network and plan selection resources are the most time consuming to build, but they will in the long term have the greatest payoff for your entity and for your assisters. And as Jennifer mentioned earlier, everyone is at a different place in terms of how long they've been doing marketplace enrollment, how familiar they are with their network. And I want what we really focus on to be how customizable all of this is. The resource y'all are looking at is one that we built, my old organization built a couple years back, that overviewed the 6 plans that existed in the marketplace, the 6 companies, excuse me, and their plan offerings. And you can see there's details connected to the plan type. There's details connected to the hospitals and network, pharmacies, et cetera, but this is very tailored to what my organization and assisters needed and requested. And the idea here is for us to give you guys some of these templates that you can make, you can sort of adapt to your needs in whatever respect works for y'all. But I will acknowledge again, it does take some work to set these up, and July is kind of an optimal time to start on that because you can prepare them from when things are going to get more hectic come October. Okay, so just to give an example of how I think these network resources add to and aid our accessibility end goal, our prize. An example would be how after open enrollment, I had a client call our program, and this client had picked the company Bright. You guys can see with this network resource, this is our newest one. We had a ton more companies enter the marketplace for 2022, which is great for clients, challenging for those of us building resources. But you guys can see there's a company called Bright. I'm going to zoom in on that a little bit. So as you guys can see, Bright from our chart shows in network with Austin Diagnostic Clinic. This is a big clinic in the Austin, Texas area. Obviously, we are not able to list every single clinic, but this is one of the big ones. So part of the work in building this resource is ensuring we know where clients can use their plans locally. So a client picked Bright, connected to the fact that they were told by an assister who was part of our program in network with Austin Diagnostic Clinic. This lady called us back in February. She was not pleased. She had been told that Austin Diagnostic Clinic has no primary care provider. So this was in direct opposition essentially to what she had been told. So I'm going to talk you guys through these resources, and then we'll talk about how this resource kind of created access connected to this client's issue. So as I mentioned earlier, I think it's important to not look at some of these things I've built. I've been building these since 2013. And this is actually one of my prettier ones, the ones I'm showing you. I've built some exceedingly ugly resources that my team and our volunteers came back and were just like, I don't know what this says. I don't know what you're trying to do, but it did not help me. And I think it's important to recognize that these things can and should evolve, that there's nothing wrong with starting simple. And this was this is one of my starting points. This is unfortunately not even the least pretty one I built. This one's actually, I think, okay looking. But this was in a world where we only had 4 companies, and each of those companies offered 4 plans, one plan each. So you can see it was a little bit easier to build and maintain. And it was 1 page. I miss these days. We expanded in 2021. So we went from having 4 companies that each offered 1 plan to 6 companies that each offered one plan. So this meant that it became a 2-pager, right? So I have this sort of overview piece as page 1, and then my page 2 got more into specific providers and whether or not they were a network. So things got a little more complicated for 2021. Now for 2022, things got haywire. And again, wonderful, wonderful thing for the community to have all these different plan options. It made my chart a little more complicated. I will say, speaking personally, I really prefer this one. This one's a little more orderly and clean. This one gets a little hectic, right? And it needs to be hectic because of the number of plans and companies. You guys can see that the company Ambetter had 3 different plans for 2022. Blue Cross Blue Shield had 2 different plans. And so that needed to be accommodated in any resources. You can see, of course, that depending on which of those plans Ambetter was being considered, there were different networks. So we had to kind of build this out in a very detailed way. And it makes it a little more hectic. And I think the good news is that not everyone had as many companies with different plans entering the market. So my recommendation is this doesn't need to be as complicated as what I had to build. And again, what I had to build because my team had come to expect it because I built it every year. We focused a little bit on oncology because we have a lot of partnerships with on Austin Cancer Center and different oncology providers in the area. And then finally, this was my sort of big painful request connected to building something that listed out the different urgent cares, labs, pharmacies, but I had never done this before. So this was my very, very first time building out this detail. And what I intend to do here is to show you guys like a good solid starting out point for this type of resource. But also if you guys have bandwidth, like if there's a need, you can, the sky is really the limit for building this out. Make sure, of course, you can see there are lots of little disclaimers all over this sheet. If this is something you're giving out to clients, you really want to make sure you are making careful note of things so they can't come back and say, wait a second, you listed 3 urgent cares, but there's another urgent care, right? I'm very clear to say it's not every single in-network urgent care, but those with multiple Austin area locations, et cetera, et cetera. I'm laying out what the hospital names mean because, of course, hospitals sometimes have larger networks than their names suggest or smaller networks than their names suggest. So that's that kind of reminder to have disclaimers on anything that a client might take away from your site with them and misunderstand without the guidance of the assister. So with the goal of giving you guys the opportunity to sort of take a crack at building these yourselves, I've made some blank versions that are going to be made available with this presentation. So that will be emailed to everyone in attendance with this presentation so that you can yourself use some of the Excel spreadsheets. And again, you're under no obligation to keep it as it is. You can mess with these, you can change them. But the plan here is to just provide a template, right? To provide a starting out point. So this is something that will be shared. And again, this is the iteration that worked for a market area with 6 health insurance companies, each of which did 1 plan. But there are ways to alter it if you want to keep this format. I actually started taking a look at Oklahoma because Oklahoma, I want to say right now, has 6 total companies, each of which have 1 plan type. So I was doing a little work to see if I could build one out for Oklahoma and see how quickly I could get that done. And again, it's not complete. As you can see, it's a starting out, but this is in theory what we're going to look at doing during our upcoming workshops dedicated to this. Likewise, however, the complicated ones will be made available. So to whatever extent these are useful for you guys to actually physically make use of, or they inspire you to build out your own template is 100%, of course, fine. So you guys will get all of these blank iterations. Again, this will include some of these follow-ups, but it doesn't mean you need to use them. And that's what I really want to emphasize. To the extent that this is useful, please use them. To the extent that it's too much or you don't think your clients need this level of detail, don't use them. Use what works for you. Okay, so pivoting back to my example of a lady who was very upset. What happened as a result of that was we double checked our tool. We double checked our information that Bright was supposed to be in network with Austin Diagnostic Clinic. And we contacted the clinic to ask her what's going on. Why is the client being told that essentially she can't access care at Austin Diagnostic Clinic when our information said words contrary to that? What we found out is the specific clinic she had called was referring to its primary care providers as internal medicine doctors for whatever reason. And the front desk person at this clinic wasn't necessarily familiar with the fact that those are technically, to an extent, interchangeable terms. So we were able to actually educate this specific front desk person at the clinic. We were able to kind of engage in a conversation generally with the manager of this clinic, who passed it on to different clinics. And then we were back in touch with the client, who we, informed, hey, this is kind of one of these hiccups. Health insurance is complicated. When you call this clinic back, internal medicine, right, is what you can request when it comes to primary care. It doesn't have to be PCP, and they should be well aware of it. But generally, why I like this is it meant increased access at every level. It taught something to the assister who was working with this client. It taught something to the clinic itself, and it taught something to the client. And I think this is one of these strange things that the resource really sort of opens up. It was a conversation my entire team had in connection to reminders, and having this kind of information on paper, I think takes us from a place where we're just enrolling people in plans and brings us closer to reality where there's continuity between that process and the actual access to care. Okay. This set of resources is even a little bit more time consuming to put together, but this is something I would really, really be interested in assisting individual entities with putting together once open enrollment begins. So basically, obviously healthcare.gov has many tools enabling you to kind of compare plans, but I think the challenge is they're not always going to suit the needs of every client. So there are some somewhat straightforward plan comparison tools that you can build. And when you guys receive this training, you can click on the links to see how we built a bronze and catastrophic plan comparison tool, and how we built a couple of silver plan comparison tools, and a company specific plan comparison tool. So I'm going to show you those right now. So this, I think, if you are going to attempt to build a plan comparison tool, I would highly recommend starting with the bronze and catastrophic one. What this essentially is it is a list in order of cost of every single bronze and catastrophic plan in the Austin area, in the marketplace in that area. So they're listed in order of cost, so from least expensive to most expensive. And why this is helpful is it gives assisters and also clients, if they would like to get into this nitty-gritty, a single place for them to look at to compare plans. Of course, you can see that Bright offers multiple plans, and this kind of gives you one space where you can look at all the things simultaneously, whereas on the marketplace, you can compare 3 at max. And it also, at least the way we've created it, tells clients what the pre-deductible covered care is, if that makes any sense. And I think especially given that we're potentially going to be headed into a world where the American Rescue Plan's enhanced subsidies go away, this could be a very valuable resource for your assisters, for clients who are needing to pick a less expensive plan. We know that most clients pick a silver plan, but given that prices for premiums could be going up, helping them understand what those pre-deductible benefits are, this cheat sheet I know was very, very helpful for my team. So looking at the silver plans, and this is of course very, very detailed, and I think you want to consider the extent to which your assisters could help with this. You can see we've gone so far as to list out basically copays associated with primary and specialist tests, so labs and x-rays, first and second tier meds, and urgent care. So this is so detailed. Note that if you decide to do this for silver, you have to do you have to do 4 versions because of the different cost sharing. So you would have to do a 94% cost sharing version, a 87 and 73, and then a base cost. So you can see that's the difference between the one that's in the former part of the screen. I think my second one isn't showing up, apologies. But you can see at the very bottom, the United Healthcare, the one on top is the base, so without cost sharing, and the one on the bottom is the 94%. So the costs are going to change based on the cost sharing. And so if you do build this for silver, you need to build 4, which can be onerous. Finally, this is going to be an example of the Bright plan comparison. So Bright, again, is a company in Austin. And what we did is, once you've built one of these out completely, it's fairly straightforward to tailor them to be specific. So this is the Bright bronze and catastrophic plan. So basically you've taken your bronze version, just delete everything that isn't Bright. And so someone who's considering Bright as a company could just compare all the Bright catastrophic plans here, or the Bright silver options here. Again, this is a different cost sharing level of silver here. So if somebody's saying, what does the Bright 2000 do compared to the Bright Healthcare $0 deductible? This can give your assisters a really, really detailed way of offering the explanation. And then finally, the gold plans. So again, if you've built out those earlier versions, and now is a very good time to get started on some of those to practice and to just kind of see how it feels to build these. Actually kind of tailoring them to focus on different things is pretty straightforward. So just a summary of the different advice when it comes to building out plan comparison tools. You want one person putting the final product together. However, I had members of my team, for example, I assigned one assister to do the bronze plan comparison and another person, and then I would kind of compare theirs and check it. So this can be a very good tool for helping your assisters learn the plans, and doing it now can really be helpful as well. Finally, again, my recommendation would really be to start with that catastrophic tool, but you could also put together a comparison for the least expensive companies if that kind of suits your client need. Okay, wanted to make sure that we left some time open for questions. My information is there, my email is there, and I'm just so grateful for this opportunity. I realized I had to cover a lot in not a ton of time, but the workshops are going to be available, of course. Those dates are the 16th, the 18th, and the 23rd of August. And at that point, going into the formats and the templates is something we'll focus on. But you guys are also free to take a look at those templates, which will be included in the email, see how useful they are. And then, you know, if that works and attending the workshop isn't necessary for you, great, go from there. But if getting more information from the workshops is of interest, those are available for y'all.
Thank you so much, Arianna, for that great presentation. And thank you to everybody in our audience. We can see in the chat a lot of sharing of resources and templates and information. It's great to see this community collaborating so well together, and we will save the chat to be sure that all these emails that you all are dropping in, so we can share those with folks who had offered to share templates. Now we do have some time for questions. So if you do have a question, please feel free to hit the Q&A icon at the bottom of your webinar screen and type a question in. And we'll get to as many as we can here in the last few minutes that we have. One question to start is there an easy way to find a list in the state that you're in of the carriers that are on the marketplace and what healthcare facilities are included in those carrier networks?
God, that's a good question. So easy way, I would say no, there's not an easy way, but I would say using healthcare.gov and using your knowledge of the state, right, which is of course specific to those who live in a certain state, can be a good way to do it. Like, I'm not from Oklahoma, but what I did was I looked up the most populated areas of Oklahoma, found a zip code associated with that county, which is Cleveland, I want to say, and looked at the companies that show up when I do a see plans and programs search of that zip code. And then I kind of cross-checked it against different zip codes in sort of the far-flung areas of Oklahoma. I looked at Tulsa. I looked at, again, I don't know how familiar people are with Oklahoma, which is fine because I'm not. But I think the trick is knowing your state is probably going to really help you, and using healthcare.gov strategically to sort of suss that out. The bigger challenge is going into the next season, because sometimes, you know, there might be rumors about a new company coming in, and the best way to get that information tends to be that a new insurer will promote themselves and will often kind of reach out to different entities to say, hey, here are the plans we're offering. So as much as you can get that information, that can be very helpful when it comes to prepping these lists. But again, where I would start is healthcare.gov, using that see plans and programs function to sort of plot out, this is the landscape, because I would say, unfortunately, there's not necessarily any easy list. And it's going to be on y'all to kind of build that. And this is the hope, to assist you guys with doing that here. I hope that answers the question.
Thanks. And we have another question kind of along a similar line. Do you have any advice around if there are inconsistencies in the data sources for networks, whether it's provider lookups from the marketplace or information from the insurance plan website or the provider website? Any advice around how you may have dealt with inconsistencies in that information in the past?
Yeah, that's actually one of my favorite and least favorite things about this work, is how much it taught us, my organization generally, about the confusion when it comes to this network stuff, where, you know, the provider will blame the insurance company will blame the provider, and everybody will blame healthcare.gov, right? There are a lot of people who can be at fault when it comes to network deficiencies. And I spent quite some time trying to follow those rabbits down holes, and eventually, you know, hit the conclusion that to an extent, it really doesn't matter who's at fault, and it may be impossible to determine. And what I care about is fixing it. So sometimes my talking point for clients related to this, especially when it comes to a new insurance company entering the marketplace for whom we don't necessarily have complete answers, is this is what we know now. However, the law is they must have providers, right? If we can't definitely guarantee that such and such provider will be in network right now because of the timing, we will find you a provider. So I think it's important to recognize, you know, the extent to which we can guarantee things, which is quite limited, frankly, but just to ensure clients understand that the law has a protection for this when it comes to network adequacy. And, you know, we've had great success in situations where a client has struggles finding a provider, sort of rattling the cages of the insurance company because of our detailed resources, where we can say, look at, y'all were showing this specific provider and network that is not working, fix it. And we've actually gotten them to fix it for individuals, but also on a broader scale, where we've kind of shown them, you need to network, you need to contract with this provider in order to have, for example, pediatric cardiology. So it really does give you a lot of power when you have this landscape, because you can start to see less, oh no, there are no rheumatologists for for this person, but rather there's actually a rheumatology issue when it comes to this specific provider in general, or this specific area. So I think the answer is, there's not a great answer, right? A lot of the times, you know, insurance companies may not have the network that they're supposed to have, but this really gives us a way of ensuring that they're held accountable for that. It gives an answer for clients.
Another question here. We have one question where someone is asking that where there may be either 2 or 3 health insurance companies that were on the marketplace in their state in 2022 that may not appear in 2023. And they have a question about whether or not you have any advice about going ahead and building out the template with those probabilities in mind, or if it's worth it, maybe from a timing perspective, to wait until the state insurance department knows exactly which carriers are going to be on the marketplace in 2023?
What I tend to recommend is if you want to undertake this, I would do it based on what you know right now. So I would basically get started building a 2022 network overview or a 2022 plan overview, because what I will say is updating something, especially during the hectic weeks of open enrollment or leading up to open enrollment, is always easier than building something from scratch. And speaking from experience, Excel is the tool I use to build these things. I really don't love Excel, honestly. Stuff happens. I have to figure it out. I have to figure out how to add an additional column connected to the plan. So the time to go through those headaches and heartaches, I would say, is now. The time to potentially give your sisters this test, this challenge of getting this information in one place, and it will teach them about the plans. It will really build their expertise in these plans. I would say do it now, because it's simple as can be to just cut a line. If, let's say, Bright drops out of the Illinois area, you just cut that, right? That's straightforward. But finagling sort of all the different information is much more difficult. Building stuff in, I would say, after the fact, tends to be harder than building stuff out. And in theory, if you're working on building it now, this could be a useful tool for your assisters for the remainder of this year, right? They can use it, or they can start to use it, and they can get practiced in how to use it during our kind of slightly slower moment in time.
And we do have a couple questions in here about whether or not some of these resources already exist for certain states. And I think our hope would be, given the templates that have been discussed in this presentation, that these would give you all the opportunity to create some of these resources for your own states with yourself or the people you work with in your state. And the workshops that we have scheduled for August, the two that are still available, which I believe, and Jenny, correct me if I'm wrong, I believe it's the 18th and 23rd of August, would give you more opportunities to ask more questions about how to create these resources for you and folks in your state.
Yeah, I'm under the impression that there are certain coalitions that have kind of undertaken this for their state, which is a huge challenge because, of course, most states in this country are pretty large and the networks vary, right? So it tends to be most accurate to do it for an area in a state. But I want to say that Wisconsin had built out a network overview, which they had expressed was very helpful to their assisters. Again, when it's for the whole state, it tends to have to be quite broad, but definitely I would recommend touching base with your various state coalitions to see, do we have anything in existence that could be a starting out place, right? And to see also, there are just so many tricks when it comes to figuring out some of this information that just come down to practice. And it's very possible that there is someone or some entity in your states already doing that. And I think just tapping those resources is certainly a great way to go. But of course, I have some of those tips and tricks, which I'm happy to share during these upcoming webinars.
All right. Well, Arianna and Jenny, we really appreciate today's presentation, and to our audience, we really appreciate all the feedback and questions that we got. As a reminder, we will be distributing the materials from today's session, including these plan and network comparison templates that we've discussed. We'll be sending all of that out via email, and we'll also be posting everything on the Beyond the Basics website. That website is www.healthreformbeyondthebasics.org. You can also find additional resources on the website, including reference charts, guides, and frequently asked questions. And if you have any questions or need any assistance, please feel free to email our Beyond the Basics contact email. That email is beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you so much, everybody, for joining us today.